How do professionals evaluate information online? How can this be helpful to your future career? Here we have advice from professors to help you evaluate reliable information. I know defines digital information literacy as the ability to find, evaluate, create and communicate information effectively and responsibly using the appropriate technology. I know teaches students digital information literacy skills to help prepare them to navigate the future of digital information.
In these videos, our I Know professors tell us how they relate the importance of finding and evaluating information to their profession. This is I Know Insights, faculty discuss information literacy in the professional sphere.
So the I Know project was done in the Nursing as Therapeutic Communicator course. So all the work that the students in my class did related to looking for resources and evaluating their reliability and suitability had to do with communication with patients, communicating with other members of the team. And we might think, oh, well, that's a very basic thing. Everybody should know how to do that. But it is a really essential component of excellent healthcare outcomes. And so there's a lot of science, lots of research done on communication tools, communication techniques, what works for different age groups, for different cultural groups. So the students had to look for materials that were going to help them develop a video on a challenging patient situation and how nurses should care and how they should not care for the patient in that situation. So it was very focused on communication and then communication within a particular patient situation. Well, nurses use information every day in the decisions that they make and how to take care of patients. So it's really important that our graduates who are going to go work into the nursing field, that they can find materials and they can read articles, updates, because healthcare is always changing, right? And we want to provide the best care that we can. So we call that evidence-based practice. So in your practice as a nurse needs to be based on science. There needs to be evidence to support what we're doing. We're not just making things up. And so nurses will be using that as one thing to be able to say, oh, well, I read an article in one of my journals. Maybe we should try this. It might work for our patients at this hospital. The other really key place that nurses have to be able to grab information and evaluate it quickly to share it is as in our role as a patient educator, okay? So you might have a patient who's just gotten a new diagnosis and they don't understand what that's about. So the nurse, it's within their role to do some quick, let me see what I can find about this, but that will be at the level that's appropriate for the patient to understand. And then they have something to hold on to and look back at later, share with their families. So it's essential that whatever we're providing to the patients is excellent information, right? It needs to be reliable. It needs to come from a great source. It needs to be understandable. So yes, our nurses are looking at materials, evaluating them, and using them in their practice every day. We want to make sure that whatever information we're sharing with our patients is appropriate, right? It's the right information. It's going to answer their questions. It's at a reading level that's appropriate for them. And typically, patient education materials are written at a fifth grade level to make sure that they're very understandable, especially for folks who may be in an emotionally charged situation, right? You want to make sure that people can understand. So it needs to be very straightforward, clear, at the right level, and in the right language. Right? And so nurses have to be aware of the resources, that there are materials out there. Sometimes you have to hunt a little bit to get materials in the right language for your patient too. I think this is something that the I Know project has really built on, that as students move through their college education, they get a lot of experiences of looking at different materials, reading for different classes, applying what they've learned in different ways, writing a paper, talking about it in a discussion. And so then when students get to us in the nursing program, they're pretty experienced with being able to evaluate whether this seems like a professional source or seems a little suspicious, and might raise more questions, so maybe we need to dig deeper. They are pretty savvy at this point in spotting information that could be inaccurate. And so they know that to be very careful to not share anything that they are not feeling 100% confident about. Almost anything on social media, you find cool things in social media, right? But we have to know, well, we have to think, where did this come from? And be willing to back up a little bit and look for where did it come from. Oh, well, it says here that it was published in Journal of the American Medical Association this month. Okay, well, let's see if it really is there. Well, then that's a great resource, right? So I think that is the thing, is just anything on social media, you really have to be careful about. But our patients bring that a lot, right? Because they're not reading JAMA articles, right? Then the next level might be like the media, news articles. Depending on the news source, it might be fine. But again, you need to have your due diligence to hunt a little bit more, dig a little bit more deeply into it to make sure that this is not something that we're sharing just because it seemed really exciting, but it's really only a study of like 4 people. You know, we don't want to make big changes in practice based on one research project. We need to have stronger evidence before we're gonna change what we're doing.